And I'll send out a copy of the recording afterwards, as well as a copy of the slides. And feel free to circulate it with anyone and everyone that you think this might be helpful for. We'll go ahead and get started. I think most of y'all on the call today are familiar with TJC and our team, but if not, my name is Emily. I'm a nutrition advocate at the Tennessee Justice Center. Also on the line with me today is Anna. Anna, do you want to introduce yourself real quick?
Hey everyone, I'm Anna and I do casework here at the Tennessee Justice Center.
Thanks, Anna. Anna is going to be monitoring the chat box and she'll elevate anything that comes up. And also if it's a quick one, she'll answer in the chat box as well. And then I think Signe just logged on as well. Signe, do you want to hop on and say hi?
I did. Hi, everyone. Signe Anderson, Director of Nutrition Advocacy. We're excited to be talking about this topic today because we think it's an important one. So thanks for joining us. And Emily has put together some good information for today.
All right, I'll go through this slide really quickly because I know most of you on the line have connected with us before. But Anna and Signe and I are on the anti-hunger nutrition team at the Tennessee Justice Center. So we focus on ending hunger in Tennessee, specifically by protecting and strengthening food assistance programs like SNAP, WIC, and child nutrition programs like school meals. We do that through a variety of different buckets. So Anna does amazing work helping connect folks across the state who are having trouble accessing SNAP primarily. So if you ever have a client or someone that you're working with who is having a really hard time accessing or retaining their SNAP benefits, Anna is available to take referrals and to help clients as needed. And then we take what Anna learns from her casework to identify some systemic issues that keep coming up for folks. And then that informs our advocacy and what we push for legislatively and administratively as far as the programs go. And a big part of our work is educating and informing too. So hosting these webinars, we do community events. We're always eager to partner with new folks, especially for in-person events right now, or if there's a flyer or something that would be helpful for the specific populations that you serve. We're here and we're ready to collaborate. And I didn't put this in this presentation, but I wanted to flag that October 21st at Second Harvest Food Bank, we're hosting a Middle Tennessee Regional Anti-Hunger Conference. This is our first one since the pandemic, and I'll send out a follow-up email with the link to register, but we'd love to have any of y'all there. It's going to be an all-day event, but you're welcome to come and go. There's different panels throughout the day, so welcome to come and go, and we'll feed you some lunch too. So we'd love to see y'all there, and I'll send more information about that in the follow-up email. And then as far as today goes, we're going to do a little bit of an overview of grandparents as caregivers. We're going to spend some time identifying barriers and then talking about what resources that we can utilize to help take action to improve food security for grandparents as caregivers. So wanted to start off with a little bit of data about what grandparents as caregivers looks like in our state in Tennessee. So 76,680 grandparents are responsible for their grandchildren in Tennessee. And you can see over there, there's kind of over here on the left, there's kind of a breakdown of children in foster care, children being raised by kids with no parent present, children living in homes where a relative is head of household. So this is kind of the makeup of folks in our state, grandparents who are raising their grandchildren. And I put a link down here to a little fact sheet that has some more information about it, and we'll reference more later, but just kind of wanted to give an idea of the scope of how many people in the state these barriers and solutions might be affecting. And then when we're talking about hunger among older Americans, I definitely want to send a little caveat, like definitely not all grandparents that are caregivers might be seniors. They might not be over that age limit yet, but we do see a lot of grandparents that are caregivers as being seniors. So I don't want to lump the two together, but I am going to focus a little bit heavier on hunger among older Americans. So maybe not even necessarily seniors, just a little bit older Americans. So some issues that we see coming up on why seniors specifically struggle with hunger: fixed income, so incomes coming from Social Security, lack of access to transportation. So I know here in Nashville, transportation is a big issue in rural areas as well, not having a public transportation system for folks to take to the grocery store or to doctor's appointments or things like that, and maybe not having a loved one around or not having a loved one who's able to leave work to take them grocery shopping and to health appointments and vice versa. A lack of health and maybe mobility issues. Maybe someone has a mobility issue that makes it difficult for them to go to the grocery store, especially if it were to mean that they would need to get on a bus or something like that. And then we also see a lot of older Americans having to choose between medical costs and food. So they're on these fixed incomes and they have monthly prescriptions that need to be bought or unpaid medical bills, things like that. Those can sometimes take precedent over food purchases. And especially we see this when an older American, a grandparent, might be caring for a child, because often that we see, and this is across the board too, we see caregivers sacrificing eating food in order to feed whoever they're caring for. As far as who is impacted the most, seniors of color, rural seniors, seniors living alone, who I was talking about before, might not have a loved one there that can help connect them to food or some of these other resources. Folks living with children or grandchildren, like I was talking about, they might put the needs of those that they're caring for above themselves. And then just a little statistic: 5.2 million seniors were food insecure in 2020. And then how does hunger impact seniors? So physiologically, we can see them at a higher risk for things like chronic health conditions like depression, asthma, and diabetes. And then obviously there's a psychological and emotional toll to not having access to enough food to nourish our bodies as well. These are a couple quotes that we've been able to collect. So we have a few story forms that we've been circulating over the past few months to collect experiences of folks in Tennessee who are food insecure. And they're pretty broad, but a lot of grandparents who are raising their grandchildren will often comment and talk a little bit about their experience, and specifically their experience feeding those that they're caring for. So I won't go through and read these, but I just wanted to take a second for us all to pause and read them, because I think it kind of contextualizes some of the things that we're talking about today and gives us an example of what this looks like on the ground for our friends and neighbors in Tennessee. So I'm gonna be quiet for a second and we can all take a moment to read these. So I think a lot of us on this call work with folks in our community base. So we often hear these stories a lot, but I think it's important as we're starting to talk about actions and things that we can do, that we have this context with us. So now we're going to talk about identifying some specific barriers that this population faces when accessing food and assistance programs and resources. So one that we talked about earlier is that difficulty feeding children on a fixed income. So Social Security, as we all know, is not a huge amount of money. So when folks are having these other people that are their dependents that they need to care for, there's an added cost to that. And specifically, and Anna does a ton of work with seniors, so she can speak to this too, but we see a lot of barriers coming up for seniors who are trying to apply for and access SNAP benefits. So a couple that we see come up a lot, and Anna, feel free to hop off and add to this or correct me or whatever, but we see a lot of folks having a hard time with the online application. So they might not have internet access. They might not be able to access the online application. They might not have access to a computer and have to do it on their phone, which adds a whole other level of difficulty. Not receiving calls for their interview after they've submitted their application, and also difficulty submitting verification documents. I don't know how many of you on the line have ever tried to submit a verification document for SNAP, but it's not the easiest thing to do, especially for folks that might not have access to like a camera phone or a smartphone to take a picture of documents on and send it in. It's not super intuitive. So that's an area that we see holding seniors up to who are trying to access these SNAP benefits. Anna, I don't know if you have anything to add to that. Okay. So now I wanted to turn it over to some of our partners who are on the line today, Marie and Tracy, to talk a little bit about the work that they do with grandparents as caregivers, and maybe grandparents generally a little bit too, just to give an idea of some of the work that's happening across the state and also some resources that are available too, and how we can support Marie and Tracy and their work as well as partners. Marie, do you want to go first?
Sure, no problem. Can you hear me okay? Okay, so yeah, here at RIFA, we see a lot of senior citizens come in our doors. And we did a study a few years ago where we looked at some research, and I think the stats we pulled were 1 out of every 3 seniors is food insecure. And so our mission is fighting hunger in the community. So we were like, how can we better address this? Because we know that transportation is a huge barrier for a lot of senior citizens. Even if they can ride the bus, when they get here, they can't always tote the food back home with them. So transportation is a huge barrier. So our solution to that was a program that we named Senior Staples. And essentially what we're doing is we package up these food boxes of about 30 to 35 pounds, and we deliver those to senior centers in our area. So because seniors are already coming to senior centers, or they're a part of a senior center and they have people coming out to their houses, so we partnered with those centers to get the food out to them. So we currently work with 7 senior centers, I believe, no, 5 senior centers in Jackson and the surrounding county. And then we partner with the Jackson Housing Authority, which is public housing. And we go to 2 different apartment complexes here in Jackson. So they rotate out when we deliver those boxes. They get one at once every other month. We'd like to eventually expand that and be doing food boxes for seniors once a month, but right now we just don't have the manpower or the food to do that. We also started doing a program where we provide Csa Boxes to those 2 apartments here in Jackson, the public housing apartments. So Csa, we just support a local farm, and they deliver us, they say a box of produce, but it comes in a bag of just whatever seasonal produce is growing on their farm. So we deliver those, we rotate out apartment complexes, and we do those every Wednesday. So like the seniors that live here at Rosewood Gardens, they get a box of staple food once every 2 months and a bag of produce once every 2 weeks. So because healthy food is another barrier, like healthy food is just more expensive. So that was one way we were like, we can get food to our seniors and we can get really high quality produce to them as well. So it's a really neat program. I think that's it. Do y'all have any questions?
Yeah, Marie, can you put your email in the chat box so folks can reach out to you afterwards too if they think of anything? Anna and I got the chance to go and visit Rifa and to go along with some of their food delivery, and they're a well-oiled machine over there. And we were so grateful to be able to ride along with Marie and do some assistance with SNAP too. So definitely, if y'all are thinking about doing a similar program, or if you are and you're running into some kinks, please use Marie as a resource, because they're doing some amazing work over there. All right, Tracy, do you want to? I know we've got two Tracys on the line today, but Tracy Vandervate, do you want to talk first a little bit about the work that y'all are doing and how folks can reach out to you and how they can support you?
Sure. Thank you. Grandparents is Parents is a program of the Knox County CAC Office on Aging. We have been in existence for 22 years. We work with not only grandparents that are raising grandchildren, but we work with aunts, uncles, all sorts of relatives that that are raising a family member's child. We connect people to resources is what we do. We do help with staff applications. We help with WIC applications, whatever the grandparent needs, then we do try to do that. We have been standing up a food box program. It's reserved only for grandparents. We've been doing, it's 100 boxes of shelf staple food and 100 boxes of produce. Second Harvest is providing the food, and we do that once a month. That's coming up next week. It's we will have to we're going to continue through the end of December, and then we're going to have to modify the program because I'm a program of one person, and and I do have a case manager that works with us, but her role has to be case management. We produce a grandparents is parents guidebook for any family, no matter where they live, and so we have about I have about almost, I'm getting close to 600 clients in our program, and that's just tipping the scale in Knox County. We know that there are about 5,000 grandparents in Knox County alone that are raising their grandchildren. So we just do a whole lot of things, and we work with other agencies to try to connect them to grandparents. I'm very glad that we're in the Office on Aging. Not all of our grandparents are 55 and above or 50 and above, depending on what age limit that you go by. But a lot of our services in the Office on Aging can reach out to younger people as well, and and serve as well there too. So we're very fortunate that we're able to do that. So, and I know, so Tracy Buckles is on the line, or is on the call too, and she also works specifically with, well, I think she works with a lot of people, but she does work with grandparents in her region as well.
Yeah, I'm going to turn it over to the other Tracy, but Tracy Vandervate, can you put your email in the chat box as well if you haven't already, so folks can reach out to you, and then we'll turn it over to Tracy Buckles, and then we'll open it up to questions for any of the partners that y'all might have.
Okay, thanks. I have been doing programs with grandparents. I started doing caregiver programs probably about 6 years ago now, with my position here at First Tennessee. I also do nutrition monitoring for our Meals on Wheels program at our congregate sites. So I have both roles, nutrition and caregiver, as well as doing some evidence-based programming. So with our grandparents, one of the things we started in Elizabethton at our Elizabethton Senior Center was a coffee and conversation group where we could, grandparents could come. We provided coffee and snacks, offered them a grandparents guidebook that we purchased for them. We partnered with the library and the extension office. And so they provided the book. I pretty much am just there to help facilitate and provide programming when needed. But one of the things we did there was allow the grandparents to kind of guide us what they needed. So one of the big things was the legal side. So of course we had somebody come in and talk about the legal side of that, but then that just matching them with resources. A lot of them didn't know to like reevaluate if they were receiving SNAP, reevaluate their SNAP benefits as they took on these grandchildren. Let's get that updated. So I'd get them to Kathleen. So a lot of times that's probably what my role is more than anything, is just being a listening ear and then getting them to the resources they need. But we now have some type of coffee and conversation group. Some of them are calling different names, but we started one at our Johnson City Senior Center, and in Kingsport we have a Grand Families Coalition group that's through the United Way, and they are working on getting their group started. They tried in the summer, but we're kicking back in with the school schedule and getting that up and going again. And the Elizabethan group had COVID had kind of stopped it, but and the retirement of the extension agent, but we have a new extension agent and she's very gung-ho. And a nice thing that we're seeing is that the schools are finally stepping in and really wanting to work with us. That's been a very difficult thing, is connecting the schools with. And so at our meeting Tuesday, we had actually 2 people from Carter County Schools, and the person from the Elizabethan Schools wanted a recording of the meeting or notes because they couldn't be there. So they are finally kind of realizing this is really an issue and something we need to touch on. And so I think partnering with them is going to be a really good thing to help us reach more of the grandparents, because sometimes just reaching them is the most difficult part.
Thanks, Tracy. That's definitely something that we have had to work through ourselves, is how to reach folks. So thank you for saying that. And I'm really excited about that partnership you have with the schools. And I think that's going to be really fruitful for y'all. If anyone has any questions for any of the speakers, we have time for that right now, but we'll also have time at the end. Anna, I don't know if there's anything from the chat box that we need to flip for the group.
There was a couple resources that are being shared that look really great, but other than that, I don't think there's any specific questions that haven't been answered.
Okay. All right, we'll go ahead and move on. So these are some resources that we've put together in ways for us to take action after the call so we can move beyond this to mobilize together as a group. So broadly, some ways that we can help, and please, I know a lot of you on this line do this work. So if there's anything that you can think of that I haven't mentioned, please feel free to put it in the chat box or unmute or whatever you feel comfortable with. But some broad bullets that we came up with were connecting grandparents to the food assistance programs like SNAP, WIC, and sharing information about how those programs can help and how they work and things like that. Advocating for legislation that improves access to the food assistance programs. We can definitely help with that. If you're interested in advocating for positive legislative changes, please reach out to us and we can provide some resources and some more context about what to look out for and what we should be supporting and what we should be looking out for. And then also referring grandparents to organizations that provide services, like a lot of the partners that we have on the line today that are doing great work directly with grandparents as caregivers. And I have them listed on another slide too in ways to contact them. And then as far as resources go, this is a list of some of those nutrition safety net programs that I just mentioned. So SNAP, WIC, National School Lunch Program, Summer Food Service Program, child and adult care food program, commodity supplemental food program. I won't spend a ton of time going into all of them right now, but SNAP is our big one that we work with and is a huge help for folks. Even though some seniors might be on the cusp and only able to get a lower benefit amount, I think when they can be connected to the program, it ends up being worth it. And then also I wanted to flag National School Lunch Program, especially I feel like a lot of y'all have probably heard parents or caregivers talking about the pandemic EBT benefits, and those are kind of tapering off a little bit, but definitely important now that we're kind of transitioning out of a lot of the pandemic school closures and stuff like that for kids to be signed up for NSLP so they can start getting those free and reduced price meals while they're going to school. And then some resources. Our partners have some of these resources, and some are from some outside partners as well, but there's some great fact sheets that I listed here. And then also Anna has created some really helpful resources to teach people how to apply for SNAP using the online application, where she literally goes through line by line and explains what to put and what to look out for and how to find the information to fill out your application. And she also has a video about how to find the SNAP application. So what do you type into Google? What do you click on to actually open up the application and start doing it? And then also if you run into a grandparent as a caregiver who needs help applying for SNAP, a lot of the Feeding America food banks in the state will help people apply. And if you come across someone who is having a really difficult time applying or who was on SNAP and then got kicked off or wrongfully terminated, you can reach out to us and we can help with that. And also we do offer a service for seniors specifically where we can screen for SNAP eligibility. So if you're working with a senior who is Anna over 65, 60, over 60, you can refer them to us and we'll do a little screening with them over the phone and to see if they're eligible. And then provide resources for them to apply after that or help them apply ourselves. This is a list of some organizations that do direct work with grandparents as caregivers, that can be a resource that we can share with folks. And I'll send these slides out after so y'all can find the websites and the phone numbers or anything you might need. All right, whoops. That's all I have for today, but I wanted to flag one thing. We're rethinking our webinars and what we want them to look like and want to know how they can best serve y'all and our partners. So we made this little survey. If you have a second, please fill it out. I'll send it along with the slides and I'll put it in the body of the email too, so you don't necessarily have to flip through all of these to get to the link. But if you have a second, please fill that out to help us restructure our webinars to best suit y'all. But I have time for some questions if anyone has it. And if you think of anything after we get out the call, please feel free to reach out to Signy or Anna and I. Our emails are listed over here on the left if you don't have them already. I'll be quiet for a second and see if anyone has any questions.
Emily, I actually have a question for the group. So we've been getting a couple of calls recently at TJC about trying to get help with, I think there's like the new childcare, or it's not new, but it's like the new childcare portal that DHS put out when they updated their website. And now people, you know, who are not necessarily families first families can apply for subsidized or free childcare. And we've had families coming to us with, you know, with grandparents and then also like just, you know, young moms as well who are asking, how can I get help trying to navigate this system? Because I think they're just not being followed. I think it's like a lot of similar issues that we see with like the other DHS programs, like with SNAP and TANF and those things. So I didn't know, we don't help with childcare, navigating the childcare assistance at TJC, and I've been having a hard time trying to find someone someone else in the state, not necessarily in Middle Tennessee, but anywhere else that can help with this. Do you all know of any organizations that are able to help either for grandparents or family members, or even just for like a college mom who's trying to get help with navigating that system for her kids?
Anna, this is Tracy Vandevate. We've been having the same difficulty with families, and DCS has a family assistance line, but that does not work for childcare. There is a separate childcare line, but we've still had trouble navigating. In fact, you all gave me resources trying to reach out to DCS to get assistance has been very difficult, especially for one of my families. And you all helped me find somebody that did reach out to the person. I don't know if everything is resolved. We think there's a problem with the portal. And when I brought that up to the person at DCS, they were absolutely insistent that there was not a problem with the portal. But we've been hearing the same kind of things. I submitted my application. I got no interview. I haven't had a call back, all of that kind of stuff. So it seems like to us there's an issue with the portal.
That's what I'm hearing too. No interview, no callback, drop, basically just like they didn't even apply.
Right. And even when I said, okay, here are the dates and here are the numbers off the applications, and this person hasn't had any callback, and they should have had 3 callbacks by now. There was like, oh no, there's not a problem with the portal. So I don't know what to do. But apparently there is a different number, and I have that at the office. I just don't have that on hand right now, but there is a separate number to call for that. It's not the family assistance line number that you would normally call.
I'll search for that, and if I can't find it, I might email you for it, and then I don't know, maybe we can talk to DHS and see, even though we don't really work with childcare that much, but I mean, a lot of our families who we work with are trying to get these benefits as well.
Well, sure. And I think people think it's under the family resource because it would seem like it's a family resource. So I think people have been calling that particular number, that family assistance line number, and they haven't been getting either accurate information or incomplete information. And people don't seem to be getting the child care number that's out there. So I think there are a lot of issues, and I guess it's just going to take DCS some time to work it all out.
Thanks for that info, Tracy.
Was it Suzanne that I put you in touch with?
A lady called me back. Her name was I think Pamela Fusting. If you
Okay. All right, maybe we'll try her again.
I did get a call back. So, and they were gonna directly contact the client. But when I went over, because I have another client and we've had other clients with the same issue, she just said, there's not a problem. This is not a problem with the portal. There's not a problem with the portal. Like, well, oh, okay.
If it's not the portal, then
yeah, then what is it?
It seems like there's a problem somewhere.
No.
All right, thanks, y'all. Do we have any other questions? Anything to add on to Anna's question or anything for our partners? Or does anyone want to flag any upcoming events that they have or anything like that? Alrighty. I'll give y'all some time back in your day then, and I'll send a follow-up email after this with the slides and a copy of the recording, as well as information about the anti-hunger conference and how to register. All right, thanks y'all. Have a good one.
Thank you.